Assalamu alaikum dear students. As we have seen earlier that there are two major groups of beta-lactam antibiotics. Those are penicillins and cephalosporins. Why we call them as beta-lactam antibiotics? Because they have beta-lactam in their chemical structures. Monobactams and carbapenems are added recently. All beta-lactam antibiotics interfere with the synthesis of bacterial cell wall, which is known as peptidoglycan. And we have seen in our previous lecture that how this peptidoglycan structures is inhibited, how its synthesis is inhibited by these antibiotics. Now we will see the clinical uses of these antibiotics. So first we will see the use of penicillins. Penicillins are given orally in more severe infections intravenously and often in combination with other antibiotics. In bacterial meningitis, for example, caused by Neisseria meningitidis, Streptococcus pneumoniae, benzyl penicillin is given in high dose intravenously. Bone and joint infections, for example, which is caused by Staphylococcus aureus, flucloxacillin is given. Skin and soft tissue infections caused by Streptococcus pyogenes or S. aureus, benzyl penicillin and flucloxacillin are given. In case of animal bites, comoxiclav or augmentin is given. And in pharyngitis, which is caused by S. pyogenes, phenoxymethylpenicillin is recommended. Otitis media, causative organisms commonly include S. pyogenes, Haemophilus influenza, amoxicillin is given. What is pharyngitis? Pharyngitis is a medical term for sore throat. Causes of pharyngitis include viral infection such as common cold and bacterial infection such as group A Streptococcus. Pharyngitis is a common condition and rarely a cause for concern. Viral pharyngitis often clears up on its own within a week or so. Next use of penicillin is otitis media. Otitis media is a group of inflammatory diseases of middle ear. The two main types are acute otitis media, which is known as AOM, and otitis media with effusion, OME. AOM is an infection of rapid onset that usually presents with ear pain. In young children, this may result in pulling at ear, increased crying, and poor sleep. Next indication is bronchitis. It is a mixed infection and it is treated with amoxicillin. Bronchitis is a inflammation of the lining of the bronchial tubules which carry air to and from your lungs. People who have bronchitis often cough up thickened mucus which can be discolored. Bronchitis may be either acute or chronic. In pneumonia, amoxicillin is administered or recommended. In case of UTI, for example, which is caused by Escherichia coli, amoxicillin is recommended. In gonorrhea, amoxicillin plus propenicillin. What is gonorrhea? Gonorrhea is an infection which is caused by a sexually transmitted bacterium that infects both males and females. Gonorrhea most often affects the urethra, rectum, or throat. In females, gonorrhea can also infect the cervix. Gonorrhea is most commonly spread during vaginal, oral, or anal sex. Syphilis. Procaine benzyl penicillin is recommended in the treatment of syphilis. What is syphilis? Syphilis is sexually transmitted infection caused by bacterium Treponema pallidum, subspecies pallidum. The first sign of syphilis is small, painless sore. It can appear on sexual organs, rectum, or inside the mouth. Next clinical indication is endocarditis. For example, with Streptococcus viridans or Enterococcus faecalis. These organisms are causative agents cause for endocarditis, and this endocarditis is treated with high dose intravenous benzyl penicillins, sometimes with aminoglycosides. Endocarditis. Endocarditis is an infection of endocardium, which is the inner lining of your heart chambers and heart valves. In case of serious infections with Pseudomonas aeruginosa, ticaracillin and piperacillins are recommended. Now we will see the clinical uses of cephalosporins. Cephalosporins are used to treat infections caused by sensitive organisms. As with other antibiotics, pattern of sensitivity vary geographically and treatment is often started empirically. Many different kinds of infections may be treated, including septicemia. For septicemia, cefuroxime and cefotaxime are recommended. What is septicemia? It is a serious bloodstream infection. It's also known as blood poisoning. Septicemia occurs when a bacterial infection elsewhere in the body, such as the lungs or skin, enters the bloodstream. Pneumonia, which is caused by susceptible organisms. Meningitis, for example, ceftriaxone or cefotaxime. Biliary tract infections, urinary tract infection, especially in case of pregnancy or in patients that are unresponsive to other drugs. And sinusitis. In sinusitis, cefadroxil is recommended. Other beta-lactam antibiotics, these include carbapenems and monobactams. They were developed to deal with beta-lactamase producing gram-negative organisms that are resistant to penicillins. Carbapenems. If we see what are carbapenems, imipenem is a broad spectrum antibiotic. Imipenem is used with celestin, which prevents its breakdown in the kidney. The main monobactam is aztreonam, which is resistant to most beta-lactamases. It is given by injection and has a plasma half-life of approximately 2 hours. Aztreonam has UL spectrum of activity and is effective only against gram-negative aerobic bacilli such as Pseudomonas species, Neisseria meningitidis, and Haemophilus influenza. It has no action against gram-positive organisms or anaerobes. Unwanted effects are in general similar to those of other beta-lactam antibiotics, but this agent does not necessarily cross-react immunologically with penicillins and its products, and so does not usually cause allergic reactions in penicillin-sensitive individuals. Thank you very much. And here are some recommended books which you can use to study this topic. Thank you very much.